Well, first of all, I'm very honored to be asked to come for this momentous time. It's your 40th anniversary. I'm the global president of the International College of Dentists, and we have representation in 142 countries. And we advocate for service to the public and education and advocating for access to care for everybody. And since we have arrived in this area, we have been treated royally. Everybody has been just very good to us, and I'm very, very impressed with the university complex. It seems to be state of the art, and you seem to be moving forward in a lot of your ideas and innovations, and I'm very, very impressed. I saw the dental school, and I also was able to get to the medical school and to the research area too. So the work that I'm seeing is amazing. You have really, I can imagine what's going to happen in the next 40 years. Well, I do see the global trends. Dentistry is becoming much more of a medical specialty, really. And with the research that we're doing in dentistry, we are becoming very valuable. People are now realizing that oral health care is body health care. So because of that, I think we are seeing a lot more interest in the dental profession. We're seeing a very large increase in females joining or wanting to be in the dental profession, which we welcome. They've made a fantastic contribution to our profession. 50 years ago, there were very few women in dentistry. Now there are well over 50%, and I think it's for the better. So I think that's another reason why you might be seeing an uptake in the dental profession. Well, my wife and Ann were here 10 years ago, and we spent 3 weeks in India. We were never in Chennai. So when I was asked to come to this conference by the ICD Section 6, we were very excited to come. While we were here, we were able to, first of all, once again, the reception that we received was amazing. We were treated very, very well. We got to visit the dental school here, which I was totally impressed with. I was very impressed with the enthusiasm of the students. We visited different sections of the dental school, and I was amazed at the amount of work that they're doing, and also the fact that the work is done in the community for free, so that the students are working or helping those who can't access care and allowing them to get work done. And in the medical area, where I was able to witness a number of things, we were able to see the research that's going on, and we've been very busy. We were only here for a few days, but we were going all the time. We witnessed many different aspects of this university, and this morning we were able to go to a rural dental school and medical school, and we spent some time there, and I found that the enthusiasm there was the same as here. And one thing I really appreciate about a rural dental school is they're providing services to individuals who maybe could not access care. So to me, that's very important in dentistry, because sometimes dentistry is not affordable or it's not accessible. So I think that was my biggest impression. But also I'm really impressed with how modern everything is, how clean everything is, and how well the school and both dental and medical are progressing. I've been a dentist for 45 years, and I've seen a lot of changes. AI is coming in, and it is very important. but it's still only as important as the individual who is using it. I know one area that there is a little bit of concern about is when individuals are applying to get into dental school. Sometimes they use AI rather than themselves to write their speeches or to do their application. But AI is definitely going to help dentistry in terms of designing implants or various aspects of dentistry. I think that in the right hands, AI will be very good. I graduated from my dental school in 1978, long time ago. We had a class of 35 students, and 3 were female. 2 never practiced, only 1 practiced. Now, if you look at our dental school, there are over half are female, and they will all practice. And I really find that that by having a larger female population, it's kind of changed the outlook of patients coming, because sometimes individuals maybe are uncomfortable with a male and more comfortable with a female treating them. One example, I'm involved in Rotary too, and we did a project in Armenia where we were helping them to equip a children's dental floor with dental equipment. We serviced 5 operatories, and one thing that I noticed when we went into the clinic, all the dentists were female, all the assistants were female. There were very few males there, and nothing against males, and I just found that it was just a very relaxed area, and the children, I didn't hear anybody crying. It was a very good space for the children. So I think that women in dentistry has made us a much better profession. Dentists have a real opportunity to help people who can't help themselves. It's a wonderful profession. It's a very flexible position in terms of, in medicine, you're dealing with life and death all the time. In dentistry, you're getting people out of pain, and I think that's a major thing with dentistry. And you're helping people look better. You're giving them a smile, and you are making them feel better about themselves. So, if you're thinking about becoming a dentist, well, you should be a giving person. I really feel you should like interacting with people one-to-one. And it helps sometimes if you have skills with your hands. It helps. But I know in my life, I was a teacher for 3 years, and that really helped me, because when I became a dentist, I worked with children and special needs patients, and I found it was a great transition from teaching. So there's a lot of work in dentistry. But you can go home most of the time when you finish your day, and you're okay. That's one. I tried to convince my children to get into dentistry, the 3 of them, but it didn't work out. 2 are physicians and 1 is in computer science, but they still think I have a pretty good job.